Hello, everyone, and welcome to the discussion. My name is Angela James, and I am a care navigator and licensed social worker with LUNGevity. LUNGevity is a lung cancer focused nonprofit organization working to improve outcomes for people with lung cancer through research, education, and support. Today, we're collaborating with Novartis as part of their Sound Up for Lung Cancer program to help change the conversation around lung cancer by empowering people living with lung cancer and their caregivers to speak up, be heard, and feel empowered. Before we begin, we'd like to take a moment to note that our discussion today is not about specific treatments or intended to provide medical advice. Please reach out to your healthcare team with any additional questions you may have about your diagnosis and care. And now to get started, we know that a lung cancer diagnosis can be overwhelming and isolating. So, how can those living with lung cancer feel empowered to speak up? And how can their support communities help them have more productive, positive interactions with their healthcare teams? To provide insight to those questions, we have two great panelists here today with us to share their personal stories, their victories, their challenges, and their lessons learned. Let me introduce them. We have Laverne McDonald. She's a social studies teacher at a New York independent school district, an active member of her community. She enjoys yoga, gardening, and caring for her pets. After experiencing shortness of breath and chest pain, Laverne was diagnosed with stage 4 lung cancer. We also have Patricia Simmers, a lung cancer nurse navigator in Las Vegas. Patricia lost her father to lung cancer at a young age, and today she works alongside people with lung cancer, their loved ones, their caregivers, helping to educate and support them throughout the stages of their lung cancer journey. Thank you, Laverne and Patricia, for joining us today. We're excited to hear from both of you. Patricia, let's start with you. Let's start by talking about the importance and challenges of communicating with your care team. Why do you think it's important for people living with lung cancer and their caregivers to ask questions and speak up about their experiences, expectations, and needs? What role can this play in a person's care?
Okay, it's very important for patients to speak up and be proactive about their lung cancer diagnosis, ask questions, become educated on their treatment. And one of the ways that really helps is bringing a family member or a friend with you to an appointment so that they can also be a second ear to hear what the physician is saying and to also maybe take notes for the patient, ask questions. Patients can also bring questions with them to the appointment. And then the other thing that's helpful is having a lung nurse navigator available in your treatment area. We offer support and advocate for patients. And that's like one way that we can help support the patient, help them know more about their diagnosis, and it helps go through the treatment.
Those are all great points, Patricia. Thank you so much for sharing that. Speaking of resources, at LUNGevity, we also have discussion guides called Questions to Ask Your Doctor. It can help patients navigate conversations with their doctors around specific concerns and topics like diagnosis, testing, deciding on treatment, and so much more. Laverne, how did you navigate questions, speaking up, and sharing your concerns with your doctors?
Sure. Thank you, Angela. I want to name that a cancer diagnosis can be overwhelming, it can be daunting, it can be deeply unsettling. At the same time, it's important to balance all of those emotions with a lens that you also have capacity to drive your care, that you can be in the driver's seat to support yourself. And so it's important that you're paying attention to what's happening with yourself. I also want to identify that one early example in my own experience before diagnosis, when I started presenting symptoms, and as you mentioned, Angela, earlier, those symptoms included shortness of breath and some chest pain. I actually leaned in deeply with my PCP. Post-diagnosis, my PCP really became the hub of my care. She was so integral in speaking with the specialists, with the oncologists, and all of the folks on the care team. She was so wonderful in reading test results, sometimes even before the specialists would call or post on my portal. She would, in fact, be calling with results of diagnostics and what have you. She was so key to keeping me informed about what was evolving around my care. So one challenge that I navigated early in the course of my diagnosis was how to keep working. As Angela mentioned, I'm a teacher at a small independent school in Manhattan, and teaching and supporting my students is very, very important to me. And again, with the support of with my clinicians, I was able to work closely with my employer, with the HR director, and also with my division director. I'm in the high school division there at our school. And we were able to talk about accommodations. We were able to think about flex time. Do I start later in the morning? Do I end earlier than everybody else? We were able to talk about sick days. And in fact, HR was wonderfully creative. Let me also name that not everybody enjoys the kind of historic, rich, and deep relationship that I have with my PCP and continue to have with her. So I want to name that. But I think it's important as you're going through your cancer journey that you build a relationship, an authentic relationship with your care team. Let them know how you're doing. Let them know how you're doing emotionally. Let them know how you're doing socially. Let them know how you're doing materially. There's a whole range of people available to you. As Patricia was naming, if there's a nurse navigator, seek that person out. Seek out your NP, your PA. Seek out the social workers. Seek out the nutritionists. There's so many people available to you to help support you in this journey.
Thank you so much, Laverne, for mentioning all the healthcare professionals, the multidisciplinary team, and how important it is for patients to reach out to them, to use them for their wealth, their knowledge. They can really be a great guide to help through the journey. So, besides your care team, Laverne, who or what else did you lean on for support? For example, your caregivers.
Absolutely, Angela. Thanks for inviting that. So, as I named, I have clinicians first at Mount Sinai and at Memorial Sloan Kettering Cancer Center. And my support has also included a circle or concentric circles, let me say, of caregivers. I just want to say that people actually want to show up for us, folks. And I want to encourage all of us to embrace the support, however it presents itself. Sometimes we might think that the support ought to look a certain way. If people are stepping up to support us, embrace it. People want to support us physically, materially. They want to be emotional supports for us.
Yeah, definitely, definitely. It's so good to hear that you had such a strong support system. You had your network. I find that for many patients, when they talk to other people going through the same thing, that can be a great source of support. And as you mentioned, there are so many support groups and just so many different ways to connect with other people affected by lung cancer. At LUNGevity, we have peer-to-peer life support where we can match you one-on-one with a mentor for patients, survivors, and caregivers so that they can get and give advice, encouragement, and most of all, hope. We have virtual patient meetups 4 times a week, multiple private patient and caregiver groups online, and just all kinds of ways for people with lung cancer to get involved. We know how important caregivers are in helping patients feel support and empowered. Patricia, what advice would you give to caregivers to help their loved ones speak up?
Okay, I often see like either a spouse or a daughter come in with a patient and they give a lot of support to the patient. So they in turn will ask me questions and I will give them education and information on what to expect next. So the best thing for caregivers is to speak up and ask questions so they can help the patient through their journey.
In addition to all the sources that we've noted, we want to make sure that we understand that healthcare teams can play a critical role here as well. Patricia, what would you suggest healthcare professionals do to encourage patients to ask questions and share concerns?
Okay, one of the things that I learned with patients is that as an educator, I want to give patients all the information on their lung cancer diagnosis, But I've learned that if you try to give them too much at the beginning, it can overwhelm them. So as a nurse, I assess their needs and I assess how much information they want to know, and I provide that to them during their first visit. And then I give them a chance to digest all of that information. And then once they come back for their second visit, we meet again and we discuss what other things they'd like to know about. And then the other thing I do is I offer additional resources for them to help them understand their diagnosis and then take it from there.
Great, great. Thank you, Patricia. That's wonderful. It's so good that you mentioned the fact of not trying to overwhelm the patient on the first visit. It can be a lot. So my next question and final question is for the both of you. We'll start with Laverne. What additional tips do you have for people with lung cancer and their caregivers?
So I'd like to just recommend that people who are newly diagnosed, that, as Patricia is suggesting, that they really lean deeply into researching their particular cancers. There's so much information available to us today, and it's so important to stay abreast of the new developments that are happening with your particular cancer. Something that might be presenting as negligible, as insignificant, might actually be part of something larger that might be emerging. And so it's important to identify that particular emergent thing and to share it with your clinicians. It's also important to learn the terms and the jargon of lung cancer and cancer in general. There's a deep well of words that are available to us. And so it's important that we learn what all of that jargon means so that we can be conversant about our cancers. It's important to contemplate questions before you show up for your clinic visits. Have a notebook, record those questions, bring them to your care team, and invite them to contemplate them long term. They might not have an answer right off the bat, but invite them to follow up with you later on to answer those questions. And also think deeply about what you might need. What do you need materially? What do you need medically? What kinds of supports might you need? Do you need time off from work? Are there other kinds of accommodations that you might need? Think critically about these and bring these to your clinicians. And if you're working, bring these to your team at work. Finally, I think it's important that you lean into the experiences that bring you joy. Before your diagnosis, you're a whole person living inside of your life, and then your diagnosis happened. I think it's important that you also connect with that self that you were before your diagnosis. You're still that person. Lean into those things that give you strength, that bring you joy. The diagnosis can be unsettling, upending, interrupting, but I recommend that you stay present in your life while simultaneously being aware of and integrating all of the changes that are presenting. Center your own joy.
Spoken like a true teacher. Patricia?
Yeah, it's really important for patients to utilize like whatever resources are available in their treatment center and to ask anybody on the care team to refer them to these resources. Another thing is support groups. There's a lot of support group systems available online. LUNGevity has connections for patients to connect with other patients with similar diagnoses. Thank you.
Thank you, Patricia. So we're almost out of time today, but I'd like to take the next few minutes to introduce a new and exciting video series from Novartis. This series aims to empower people living with lung cancer and their caregivers to speak up. We're going to hear real quotes from people with lung cancer, caregivers, healthcare providers, and we'll see what happens when they switch voices.
When living with lung cancer, conversations in the doctor's office aren't always easy. To help people with lung cancer and their healthcare providers build stronger relationships and have more open conversations around screening and treatment, we switched their voices. Each read real quotes from the other side's perspective, stepping into one another's shoes to create understanding and empathy.
I've been working with lung cancer patients for about 20 years. So you can only imagine the changes I've seen in treatment and survival.
I was diagnosed with lung cancer several years ago, and I'm still here.
It's important for me to have a good relationship with my patients so they can feel comfortable sharing their feelings. It's important that the doctor and the patient are on the same page.
Feeling like we're working together went a long way towards making me feel better about the relationship. It made a huge difference for me personally. I felt like the more I knew about it, the better armed I was to cope with it.
My patients aren't just another visit or another number. You're going to do the best you can. You're going to advocate for them. We provide what we call patient-centered care. They develop a trust in you.
The first thing that healthcare providers can do to make their patients feel empowered along their cancer journey is to communicate. That's the number one thing I hear from patients. Well, I just wish they would have spent more time and told me and explained it a little bit clearer.
I think it's important that you're confident about your own feelings about your own body. And it's important that you communicate everything you're feeling to your doctor and not be afraid of what might be on the other side of that.
I have been living with lung cancer for 3 years now.
I am a specialist who's been treating lung cancer patients for over a decade.
When I was first told I had lung cancer, all that I can remember was silence for a few minutes. It felt like an eternity of silence.
I know that it's a lot to take in, but that's why we want to encourage the patient to speak up, to ask questions, so that the patient really gets a full understanding of the disease and the situation.
Looking back, I wish I could have gotten more support. I wish I would have been told that I wasn't alone. And I have learned that I will advocate for myself. I will speak up.
What I will say to a patient is this is an overwhelming time and I know you feel vulnerable, but you are the CEO of your own health. You have to be the one to be able to ask questions and challenge things that you don't understand and make the final decisions. It's really important.
Wow, that was so impactful and interesting to hear the different perspectives. I hope you guys enjoyed it as much as I did. It's been a true honor to moderate this important discussion. I want to thank our stellar panel members, Laverne and Patricia, for participating and sharing your stories and your insights. Also, a big thank you to the Novartis team. Remember, while a lung cancer diagnosis can be overwhelming, daunting, scary, please remember that you do not have to go through it alone. Thank you again and have a great day.